And of course, we have one more abstract. Yeah.
Yes.
Yeah. So I'll briefly, so this is similar to the one Matt talked about in terms of variant histology. We looked at sacituzumab govitecan outcomes in patients with variant histology. So we had about 116 patients total. We compared 44 patients with variant histology with any percentage component to 72 patients with pure urothelial histology. And among those 44 patients that had any variant component, 33% had UC predominant, which was over 50% component of urothelial, and then 11 patients had variant predominant, so over 50% of variant histology. Now, when we looked at that, the observed response rate was 24%, and most interestingly, I thought, was that 94% of these patients had received SG post-EV, so that was also reassuring. One of the interesting things I noted about the response rate was that we had 8 plasmacytoid patients, and of the 6 that were evaluable, none had responses. So that was one that really stood out to me. We had 2 patients with neuroendocrine, one of them had a response. So 2 small numbers to say, but the plasmacytoid definitely raised an eyebrow. And then in terms of median progression-free survival is 3.7 months, and then overall survival is 6.7 months. So again, it looked like there were no differences when we compared pure urothelial and variant histology, any component, and there were also no differences when we compared the 19 patients with any squamous component to pure urothelial patients. So the takeaway from that is that SG, even post-EV, appears to be pretty active among different variant components, although, with greater numbers, it would be interesting to look at the plasmacytoid patients.
Yeah. I think it really highlights, looking at kind of as we move forward with this, we're clearly going to be wanting to look at how enfortumab partners with pembro in the real world population. And I think the big question that everyone's going to have is also going to be, how do agents perform after that combination? I mean, how does chemo perform? How do these others perform? I was intrigued that the response rate with SG was in the low 20 percentile. My personal clinic experience had not been overly favorable seeing patients respond. Median PFS was on the short side, under 4 months. Median survival 6 months. Just again highlighting that this remains a tough space for patients. And it could certainly evolve as that potentially becomes more of a second-line treatment option for some, as compared to now a fourth-line treatment in terms of where we looked at it. And so there's a lot of questions, I think, still to be asked about sequence and how drugs perform after EV exposure.
Yeah, absolutely.
And then just, for variant histology, doing these prospective trials in variant patients with variant histologies, they're tough trials to do, but there are 2 neoadjuvant trials, at least in the muscle invasive space. So accelerated MVAC and Pembro, which Dr. Kaki and Dr. Grievous were involved in developing. And then also SG, neoadjuvant SG and variant histology also. They're both phase 2 pilot trials. So those will give us some information as they read out over the next few years in terms of how outcomes are in variant histology.
Yeah.
So.
Absolutely. So much compelling data, almost left out one abstract, but I'm glad we didn't.
Yeah.
Well, yeah, with that, again, thank you guys for all your contributions as well as the input today. And yeah, really appreciate working with all of you on this.
Thank you for your leadership.
That's an honor. The Unite's a great program,
Yes.
so happy to be part of it, Vadim.
And we look forward to many future great projects and hopefully additional great data to help patients.
Absolutely.
Certainly beautiful collaboration opportunity, yes.